My name is Jennifer Harris. I'm the Chief of Media Services for Charles County Government. Thank you all for joining us here today. We are going to be talking about our Stage 1 reopening plan, which will be initiated on May 29th. I'm pleased to introduce Commissioner President Reuben Collins to kick things off. Following brief remarks by Commissioner Collins and the Chair of our Chamber of Commerce, Tom Blanford, and Dr. Haft, who's overseeing the COVID-19 health emergency here in Charles County, will take some very brief questions. Reuben Collins' name is spelled R-E-U-B-E-N-C-O-L-L-I-N-S.
Good morning, ladies and gentlemen. Thank you for joining us here today. The Charles County Board of Commissioners is pleased to partner with the Chamber of Commerce to help our business community reopen on May the 29th. I'd like to take this moment to recognize those who stood with us and are prepared to answer questions later about our reopening plans. But before I do that, I'd like to certainly thank Meinhardt Properties for allowing us to use the space today. I'd like to start by acknowledging my colleagues. I have District 1 County Commissioner B.J. Bowling. I have District 3 Commissioner Amanda Stewart, District 4 Commissioner Bobby Rucci, and I'd also like to acknowledge our District 2 Commissioner Thomasina Coates, who is unable to be here today. The Charles County Chamber of Commerce, Tom Blanford, who is chair, and Bonnie Grady, president and CEO, are here today. I don't think she's here, but Doris Kamek Spencer, chair of the Southern Maryland Minority Chamber of Commerce, was also instrumental in putting together this kickoff. We have Charles County's Director of Economic Development, Darrell Brown, here. We have the Town of La Plata Mayor, Janine James, and John Flatley, who represents the La Plata Business Association. We also have the Mayor of the Town of Indian Head, Brandon Paulin. We have several members of the clergy here, but so I'd like to recognize a couple. Pastor John Lewis, Servants of Christ. Pastor Aaron Jones. And I believe I saw Reverend Thurkel Freeman. He's here. And representing the Charles County NAACP, Diotha Sweat, who's president. So like you, we're eager to invite the community back into our small businesses in a safe and sustainable manner. I know everyone has made significant sacrifices over the past couple of months, and many of you have adopted in unique ways to keep your business going while its doors were shut. It has not been easy, but we appreciate what you've done to stop the spread of the virus and to keep our community safe. As we move into Stage 1 of our recovery from COVID-19, we have never faced such a difficult or more important moment. We are depending on one another to each do our part to ensure our community stays safe as we gradually reopen our doors to them. It is also necessary, as we look to revive our local economy, put people back to work, and provide the goods and services our community needs. Charles County is now fully ready to move into Stage 1 of the governor's roadmap to recovery. That means that our retail stores, personal services like hair salons and barbershops, and local houses of worship may reopen up to 50% capacity. We want to remind the public that you all are still safer at home, but we are prepared to invite you back into our businesses with the appropriate precautions in place. Our businesses will be following all safety protocols, have received training through our health department, and access to PPE vendors through our emergency services division. The safety of our community depends on all of us. That is why I'm asking our public to continue wearing face masks and practice social distancing when you do decide to shop. Our businesses and churches are set up to help you do that and work together to keep safe. I'm proud that we've been able to leverage our collective knowledge, resources, and innovation to develop an effective approach to achieve these goals. I'm confident we can do this responsibly because we are moving forward together. Now at this time, I'd like to introduce and welcome Mr. Tom Blanford. He's chair of the Charles County Chamber of Commerce.
Good morning. Thank you, Commissioner President Collins. I want to assure you and all residents of Charles County that all businesses in Charles County have been and continue to prepare to reopen in a manner that will allow us to safely serve our customers. The health of our community, customers, and employees is our top priority. At the Chamber of Commerce, we've worked with any business, not just our members, to help them understand and follow CDC and Maryland guidelines. For reopening, to educate them on the need to follow social distancing regulations and ensure that they are following best practices as they prepare to reopen. We stand here today with our partners, the Southern Maryland Minority Chamber of Commerce, the La Plata Business Association, the Indian Head Business Association, and the Western Charles County Business Association. All of these groups have been working together with Charles County, the Health Department, and our local municipalities, Indian Head and La Plata, to demonstrate to the community that we are ready to open safely and responsibly. At the Chamber, we understand how important it is for businesses to follow these guidelines in reopening. It's just as important to stress the other side of that. As we emerge from this pandemic, it's just as important that we support our local businesses. Strong businesses make strong communities, and our local businesses are the very backbone of what makes Charles County such a great place to live, work, and play. We are all aware of the need to rebuild our economy, to regrow our tax base, create more jobs, and more importantly, preserve our quality of life. That's why I encourage every resident, every homeowner to remember that the road to rebuilding our national economy begins with rebuilding our local economy. President Collins, as we move forward, I hope we can build on this by working jointly to authorize reopening for Phase 2 and Phase 3 businesses. The Chamber, the Southern Maryland Minority Chamber of Commerce, the La Plata Business Association, the Indian Head Business Association, and the Western Charles County Business Association stand ready to work with our entire business community as we did with Phase 1 to ensure they can open safely and responsibly. We can make Charles County strong by making it a priority to support the great local businesses that support our charities, our youth sports programs, our places of worship, and make Charles County the place we are all proud to call home. We are ready to open safely and responsibly. We are Charles County strong. And we'd like to take a second just to acknowledge Doris Kamek Spencer, who is not here, representing the Southern Maryland Chamber of Commerce. Very instrumental in bringing us back. Thank you.
So at this time, I'd like to invite Dr. Howard Half, who will speak more directly to the technical issues that are a part of our understanding of and preparedness for this reopening.
Thank you, Commissioner Collins and commissioners and other esteemed representatives here. It is a great pleasure to be here today and talk about Charles County opening. Charles County is ready to open under phase one of the governor's plan this Friday, and it's able to open up at this time for the same reasons that other places in the state now have been able to open also. That we've seen a decline in the number of beds used in the hospitals for COVID positive patients, a decline in the ICU beds, and we have sufficient capacity here in Charles County and in other places around the state now to be able to deal with this terrible virus. This has been a difficult trial for us over the last several months. I look around and see people who are socially distancing with facial coverings on. That was unheard of 6 months ago that we would be meeting in this way. But the truth is that this virus is still among us. And in order for us to continue to be successful, we'll continue to need to do those things that are important to keep us safe, even as we open our industry and our businesses and begin to establish what looks like a normal life again. And there are a couple of things that give us comfort in being able to do that right now. One is the ability to do broad-based testing individuals who are symptomatic, test those who are asymptomatic, and being able to make sure we stay ahead of this virus. As emblematic of that, just up the street here at the CVS, there's an ability now to do drive-through testing for individuals with pharmacists ordering the tests. And not but a few miles away at the vehicle emission testing site, there's continuing to be ability for people to drive through under orders from their providers to get testing done. And testing is expanding all over the state. It's with that testing that we'll be able to early identify where cases come up, even as virus circulates in the community, and cordon those off. And that produces safety. Also, we've established a tremendous program across the entire state of what's called contact tracing. So whenever there is a positive test, that individual, in addition to that individual being self-isolated, the contacts who they were in touch with will be identified and tested, and if they are positive, they'll also self-isolate. This is the way that public health leans in and controls any epidemic. We couldn't have done that a few months ago, but we can do that aggressively now. We also have much, much more in the way of personal protective equipment. Looking around, I see that on everyone's face here, and many with gloves also, and we have ability to do surface cleaning and all those things that will be the tools that we battle this virus with. So all of those things are in place. But ultimately, it depends on what all of our actions are that will dictate what the outcomes are here. We all have faith in the future, but it's the acts that we do between and among us for our businesses and for our public that will dictate what that future looks like. And I thank you for your time.
At this time, we'll take some brief questions from reporters if you have any.
Yeah, as you know, when the governor made his announcement, when he made the announcement to allow each jurisdiction the authority to opt towards phase one, he essentially did give each jurisdiction an option to come up with a plan, if you will. The reports that we received from our health department were definitely favorable. But a majority of the Board of County Commissioners opted to basically extend that stay-at-home period for 2 weeks, and we voted to actually move forward with phase one on the 29th. Many factors are involved. I mean, certainly looking at health statistics more than anything else, but also in the abundance of caution, recognizing that concerns that have been raised by many of our citizens about the whole idea. And I believe a lot of that is just based on misinformation, because I think there's an impression that when you hear that we're reopening, I think people are putting that in the context of a literal reopening. And that's really not the case. And what we've done and what we've taken advantage of was this opportunity to actually provide additional information to the general public on what Phase 1 actually entails. Well, that would definitely be a board decision. I can only imagine that it will be a very engaging discussion, but it will be one that we certainly anticipate. I think we're just as ready as any community in the entire state to move forward.
Apologize, we're getting some interference. You have it fixed? Okay. I also want to remind the press that we do have two pastors here. Churches are part of this as well. If you need questions that you have for churches, we have Pastor Lewis and Pastor Jones behind me who are available for questions as well, or post press conference interviews.
Church is always ready to serve God. But what I want to read to you today is a text from one of our members. And I want you to hear what she has to say. She was stricken with the coronavirus. And I believe what she says will out-echo anything that I could possibly tell you. She says, as a member, someone that has contracted the virus, that she is excited about the fact that we are being cautious as we regather. She says that the time that our commissioners have given us to rethink this situation has been the time that's necessary for us to learn more about the disease that she was stricken with. She also let me know that she wouldn't have wanted to be a conduit of giving someone else the disease, the virus, and she mentioned that she did not want to be reinfected as a new kidney recipient. I believe that, and she also gave me permission to give you her name. I believe that Gloria Burrows' words speak much louder than mine as it relates to church. Thank you. Well, I'm glad you asked. I thought you'd never ask. Our services have been on the parking lot since day one. We have been having something called Park and Worship. Our members have driven down because church is about people coming together. It's not about what the pastor says or what the pastor thinks. Those are people that are congregating together who've helped each other through a hard time. When they were sick, they prayed with each other. When some were getting kicked out, they gave each other money to stay in their places. Church is about a community of people, so it's never been about the building. However, the building is where we gather. So our congregants drove down every Sunday so that they could get a look into the other's eyes. This Sunday, what you'll see in our church, we're sitting 10 feet apart. They're probably not going to be more than 30 people in the building. They're also going to be out on the lawns, and they're still going to be in their cars. So thank you very much for the opportunity to tell you that.
Any other questions? Any reporters? Okay. All right. Any commissioners have any final thoughts? Okay. Come on forward, Commissioner Stewart. Commissioner Amanda Stewart, MED.
Good afternoon, everyone. I just wanted to take this time to just say that our thoughts and prayers go out to all of the family members that have lost family members and friends through this pandemic. And so I think throughout this whole conversation and how we move forward together as a community, I think first we need to remember those that we have lost. And I just wanted to take this time to just recognize those families and just remind them that they are in our hearts and our prayers. Thank you.
All right, if there are no further questions, we'll wrap up, and everybody up here will be available for any follow-up questions for a short period of time. Thank you all for coming today.